Canada has terminated a multi-million-dollar contract with a Malaysian manufacturer of PPE because of allegations that gloves intended for use by Canadian health workers were made with forced labor. Janice McGregor has been investigating this for us, and she's in Ottawa with the details about how these labor practices came to light.
Yeah, good morning, Heather. What we actually know about this comes from an American investigation. Back in October, the U.S. Customs and Border Protection Agency banned shipments from 5 different Malaysian suppliers of disposable medical gloves. They said they had found evidence of forced labor, and one of the companies, subject to these allegations was Supermax, which has a contract with the Canadian government worth over $222 million. So a valuable contract. The Americans, said they had evidence of forced labor. How did they know that? Well, the International Labor Organization has a set of indicators to help define what constitutes forced labor in cases like this. When U.S. investigators worked with worker advocates on the ground, digging deeper into the conditions at these companies, they found 10 of those indicators present. These companies use foreign workers from countries like Bangladesh and Nepal. The workers have to pay what they call recruitment fees, steep ones. They often end up indebted to their employers. At the same time, they're trying to send money home to support their families. They're housed in very crowded bunkhouses, row upon row, no privacy, asked to work long days, 6 days a week, under very hot working conditions. And during the pandemic, some of them were unable to leave the premises for up to 18 months. Their employers were withholding their passports. I spoke to Nusra Uddin. She is a British solicitor who is currently bringing legal action against the British government because the National Health Service there is refusing to stop its contracts with this supplier. She says the labor conditions there amount to modern slavery. And, it's fair for countries in the West to want to protect their healthcare workers, but they shouldn't be doing it by exploiting workers in other countries. Take a listen.
Seeing this as a global issue now, the world is becoming smaller, and we're really understanding how many of our products, whether it's in our supermarkets, whether it's our clothes, whether it's now our medical supplies, that are really tainted with the exploitation of others around the world. And do we want to be, do we want to have blood on our hands as buyers in the West?
And she said, there's been evidence that this industry is problematic from a human rights standpoint going back to 2013, 2014. She says the answer is for governments like Canada's to cut these companies off until they stop abusing their workers.
I think people listening to you, Janice, might wonder how Canada could even enter into a contract that has labor practices of the sort you've just outlined.
Yeah, well, you might remember back at the start of the pandemic, we heard about this global scramble to find PPE from kind of any source available, right? And Malaysia is a major supplier of medical gloves like this, makes about 2/3 of the world's supply. So it would be a natural place for Canada to look to procure large volumes of medical gloves. But Public Services and Procurement Canada hasn't answered my question yet about what kind of checks it did before signing this contract with this supplier to make sure that its labor practices were sound and in keeping with Canadian values. Canadians only stopped their deliveries from this company in November after the U.S. investigated and took action. And that's despite the fact that a number of Canada's trade treaties are supposed to be prohibiting products made from forced labor.
Janice, thank you. And there's more that anyone interested can read. Your piece at CBCNews.ca for further details. Appreciate it, Janice, in Ottawa.